But there are some things to consider about how it can help. Jenna Lee Moman and Whitney Rathwald are here from CaringEdge Health and Hospice, and they're going to debunk some of the common myths about hospice care. Good morning, ladies. Thank you for being here, and welcome back to North Dakota Today.
Good morning. Thank you.
Before we get into the myths, and we do want to run through those, I want to ask just an overview of CaringEdge and what it is that you guys provide.
Okay, CaringEdge. We are located here in North Dakota in Bismarck and Minot. But for the Bismarck location, we have outpatient services, home health services, and hospice. And the disciplines included are anywhere from physical therapy, occupational therapy, speech therapy, nurses, social work, spiritual counselors, CNAs, and volunteers. We've got a great volunteer program.
You know, when you describe that, that basically debunks the first myth right off the bat, and that is if you go into hospice, you have given up.
Right, and yeah, that's just not true. It's just a different way of looking at your health care. No longer seeking interventions, but the comfort and quality of your life.
Okay, myth number 2, hospice is an actual building or a place that you go.
No, that's not true. Hospice is a service, so we go wherever you call home.
Okay, number 3, hospice is only for cancer patients. Anyone else nearing the end of life, it's not for them.
Also not true.
False.
That is false. Yep. Of course we take cancer patients, but we take end-stage renal failure, end-stage heart failure. We also have respiratory, so COPD, stuff like that.
Okay.
Dementia.
Now, just to remind the audience, what I am presenting here to the ladies are the myths of hospice.
Correct.
So I'm not trying to leave somebody with the wrong impression. Number 4, in the final days and hours of a person's life, there will be pain.
That's not necessarily true. Everyone's journey is different, and what's great about a team that you have that's focused on your care is they can triage that for you. So everyone's journey is different.
Okay. Number 5, hospice will hasten the oncoming death. It'll make it happen quicker.
Yep, that's not true. We, of course, we don't slow things down or speed things up. We listen to every individual body on how they're declining. There's actual studies out there that prove hospice can extend your life by about a month.
Okay. Number 3, and we talked about this in the green room, the ladies and I, former President Carter was in hospice for a long time, and I think the myth is that, you know, hospice is only for a couple of weeks or so. That's not true.
No. Hospice should be used a minimum of 6 months. That is the goal, so you really get all the benefits of the program that it offers. But depending on your declines, you can be on hospice for a longer period of time.
Okay. Another myth is that it's only for the patient that hospice is designed for.
Correct, that's a myth. So the center focus is patient and whomever they call family. And around that is doctors, nurses, spiritual counselors, social workers, CNAs, volunteer. And the center is the patient and the family, so you're really driving on what you want your end of life to look like, what you want your health care to look like. And we are just the big team helping you with that goal.
I think that's the thing that stuck out in my mind is the organization of an entire group of people, various different team members that are there for the patient and the family.
Correct.
Yeah.
Okay, now, hospice says if once you enter hospice, you have given up all control over the amount and quality of care.
I would say it's actually the opposite because, like Jenna Lee said, it puts you in the driver's seat. So you're deciding when it's appropriate for a med reduction, what kind of services you want. Certainly there's people who don't want all those staff members to come in right away, and that can fluctuate throughout your care. So you get to decide everything.
Okay, number 9, and we're down to a minute left. It's only about, the only thing that hospice takes care of is meds and pain relief.
No.
Nope. We bring in medical equipment, whatever the patient may need to have the quality of life and safety. And that can be, you know, if their goal is to stay in their home, we ensure that we do everything in our power to keep them in their home so we can help bring in home care agencies. And then if it's just not realistic, then we can help transition them to assisted living or a skilled nursing facility. So.
Okay, as you look at the information on your screen, I've got number 10, and I want to send that over to you, Whitney, that hospice patients must sign a do not resuscitate.
That's actually not true. They're comes a conversation of when it's most appropriate. But you can enter a hospice program as a full code. Certainly, most of the time, just people need education and reassurance on why and what's going to happen, and we do that for you.
Yep.
Jenna Lee and Whitney, thank you so much.
Thank
We
you.
appreciate you coming in and trying to correct the record on so many of these things. Like I
Yes.
said, when I read your list of myths, I'm like, yeah, that's what I thought it was. So
Yeah.
we appreciate your